Over the last 25 years, I've had the privilege of interviewing and highlighting some truly interesting people. I mean, everyone who is anyone, both the famous and the infamous, from presidents and the first ladies to kings and queens, movie stars and pop stars, captains of industry, heads of state, sports personalities, innovative entrepreneurs, and some pretty fascinating everyday people. Today, I'm happy to introduce you to Dr. Lili Barsky, an innovative physician and medical professional who hopes to integrate her experience and training in medicine, engineering, and AI to help transform the approach to patient care. Being a heart disease survivor, Dr. Barsky, I love hearing anything that can be transformative for patients in healthcare. And so I know you clearly have a lot of passions. Tell me how these interests intersect with each other and medicine, and how is it going to benefit people like me?
Well, thank you so much, Star, for a beautiful introduction. And really, I'm honored to be here with you today. So, when people ask about my varied passions, I find it an interesting question, and it's something that has evolved for me over time. So, when you think about medicine, traditionally, you think about science and the technical aspect and treating a disease. And so that's always, of course, been of incredible appeal to me, the pathophysiology and the mechanisms underlying how the body works and how it works differently in different people. But I think what has also driven me and something that I have grown with is just how much it is about treating the person. And so we're treating the disease, but at the same time, we're treating the human spirit. So how can I use this plethora of growing knowledge, tools, procedures, and techniques in order to help you heal? And as you can imagine, and it varies from person to person, and that's based on how individuals experience the disease, their goals of care, their circumstances, their perceptions, and their feelings and needs. And so that's really what's drawn me to medicine over time. And what I think is really interesting is that process involves a lot of empathy, but it also involves a lot of creativity. And so by engaging in the arts, which is something that for me, I've always loved as an outlet, it's very liberating for me to create things. I just love it. And that this has been since childhood. But what I've come to discover is just how many parallels there are between art, engineering, and medicine. And it's not just the creative process, but also this idea of problem solving, adaptability, thinking ahead, and thinking outside the box. And these are things that are applicable to everything from, if you're making a video, you have to anticipate if things pop up, how do you address that? And sometimes unanticipated things pop up. The same thing can be true when you're coding an algorithm in artificial intelligence. You have to figure out how to debug it, which can be so stressful. And at the same time, when you're treating a patient, things happen along the course of treatment that stimulate you to think, maybe I have to change directions here. Maybe I need to reassess what's going on. So that's really been true to all three domains. And then the other major thing is being able to really empathize and understand people. So when I'm creating a character, on stage or in videos, and painting someone, painting a portrait, I love to look at all aspects of them. It's a deep character study for me. And I think paying attention to level of detail has really helped me notice subtle things and clues that can help me make a pretty challenging diagnosis. And it's actually kind of extraordinary how that happens. And it's very inspiring to me. But I just love how there's so much overlap in all three domains, and I enjoy doing all of it. And so it's made me very happy, and it's very inspiring to me and to my growth as a clinician in person.
That's so interesting to hear you talk so passionately about all of the things that you're doing. My dad used to say, find something you're passionate about and then figure out how to get paid for it. And you have seemed to really seamlessly find the things that give you joy, which is extremely important because I know it reduces stress in life. One of the things I loved finding out about you is that you provide medical consultation on film and television scripts. And since that's some of the things that I get to do a lot from a legal perspective, tell me, why do you enjoy doing it?
Yeah, so really film and media and film and TV consulting for me has been first and foremost, a really wonderful way for me to integrate my passions for medicine and creative writing and storytelling. And what I've also really come to appreciate about it is that I think that TV and film are very powerful venues for relaying important information. And you could talk about anything from some of the more obscure medical conditions to major healthcare issues affecting us today. And I think it can be so meaningful to our audience to hear it through a beloved character or being told through the lens of someone that's struggling on TV that they might not otherwise witness in real life. And so in that vein, I've really come to enjoy contributing knowledge and helping shape storytelling to transmit very important messages about how patients experience different diseases, how procedures are done, what the workflow is like in the hospital, and kind of introducing the general population to life in the clinical setting. So that's been very meaningful to me. And I thoroughly enjoy working with the team. And I love when the production team takes the due diligence to reach out and understand how to accurately and sensitively portray these sometimes very troubling and complex themes.
Dr. Barsky, one of my very favorite shows on television just happens to be Grey's Anatomy, and I'm the national volunteer for the American Heart Association, and I know that we worked really extensively with Grey's Anatomy on one specific episode where one of their leading characters had a heart attack and was diagnosed with heart disease. And as a woman who has some sort of cardiac incident, oftentimes hospitals and doctors don't react and respond in a way that is positive for the patient. And I was so impressed with Grey's Anatomy really conveying that women's symptoms are different and that oftentimes they manifest themselves as stress related or anxiety related. And all of that was exposed and expressed on the show. So what you all do as medical consultants really and truly can change people's lives. I'm a heart disease survivor, so I know that the symptoms do manifest themselves differently in women and in men. And I guarantee you lives were absolutely saved. So again, I'm being very selfish here on behalf of patients everywhere. We really do appreciate being able to see ourselves on television and in film. Because if you see it, then you can be it and then you can change it. Wouldn't you agree?
Absolutely. And that's a very good point. And I'm so appreciative to hear that as well. It's always wonderful to get patient feedback about what we're portraying on screen. And so it's beautiful to hear that that's actually influencing you as a star in such a powerful way.
Absolutely. And I know that at least some of your past work, you've been creating some informative video productions, such as that medical case presentation that was based on Beauty and the Beast. I was fascinated about that. You did that for your Yale graduation. Tell me what inspires you to make these kinds of projects.
It's kind of in parallel with what we were just talking about. It's like the same high that I get from finding creative ways to relay otherwise heavy and sometimes even dry information. And so what I have done is I've always loved creating, but in high school is when I discovered filmmaking. And so I mostly did some broadcast journalism pieces and I started making more music videos. And what I really loved about filmmaking was how you could use that as a medium to not also provide useful information. And so more recently, my work has focused on taking musical tracks, beloved ones known to people, and applying them to play in different things. So almost like musical public service announcements. And so you inject a little bit of, you have the music, you have the comedy, you have the content. And basically I've taken, for instance, the Beauty and the Beast portrayal was meant to use the song Little Town to show a morning in the life of a medical resident in training. And I also did the Corona Block Tango, which was taking Cell Block Tango from the musical Chicago to explain COVID precautions. And so those are just some examples. But what I think I really love about, or what I've found, is that audiences will learn and find things resonate more when it's to the tune of something they're familiar with. And so I find that people actually, it relays the information in an entertaining, comical way, but also kind of sticks with them. And that's the feedback that I've gotten. And so I've started to use that more often. And it's just, again, merging my passions, but also allowing me to really try and reach out to the public in a creative, hopefully entertaining way.
Lili, all of that sounds fascinating. And every time I read something new about you, I see something new that I'm not aware of, and I really want to know about it. What is this ZAC initiative?
Absolutely. So, as you are an advocate, I think you really appreciate this, Star. So, the ZAC initiative is named after my brother, Zach, who has had a heroic struggle with Asperger's syndrome. He's on the autism spectrum. And what it is basically my labor of love to address what I have found to be a significantly underrepresented disparity in healthcare. And that is how we care for and understand individuals with special needs and a variety of neurodevelopmental conditions. And I discovered this relatively early on. So having worked in the ambulance, the ER, and the inpatient and outpatient clinic settings, it really stood out to me how there seemed to be some misinterpretation, a little bit of confusion about how to communicate with people who may express themselves differently, a way that we're not used to, who have certain behavioral and physiologic differences that warrant us adapting how we take a history, how we perform a physical examination, and then also how we plan their care.
You know, it's so interesting. Let me interrupt you for just a second, because when you often hear people discuss what you're talking about, they refer to people as, quote, disabled. I call them differently abled. Having worked in diversity, equity, and inclusion for a lot of years, I hear what you're saying, because I have a nephew who is on the autism spectrum, but he is probably one of the most brilliant mathematicians I've ever met. So he may learn and express in a different way. And I think it is up to us in society to learn how to communicate with people who learn in a different way and not treat them like less than, but instead competent members of society that can really contribute. And I think that's probably what the ZAC project is working on.
I 100% agree, and you're absolutely right. And I think we've heard about it in the news, but we've heard about it from the standpoint of law enforcement and some incidents that have really stood out, but yes, there are parallels in healthcare. And what I think really resonated with me is when I started doing research into it, this is not something that's a traditional part of our medical school curriculum. And when I surveyed my peers, really only about 45% felt comfortable managing an acute behavioral crisis, for instance. And so I think that that was something that really stood out to me. And when I actually looked into the body of literature out there, there's pretty extensive research, very thoughtful studies that have been done, but they're far and few between, and you really have to dig to find them. So the goal of the ZAC initiative was to initially develop a lecture series that compiled all those resources into something that I then presented to first responders, medical professionals, and peers, and then also something that they could listen to. And then I realized, well, what about having a compact, accessible resource that they could refer to anytime? And that's what led me to develop a resource, which was a guidebook that I illustrated that basically explained all these things, both for providers and also for patients and their support system.
That sounds really wonderful. And someone who has been a healthcare advocate for many, many years, it works right in to the kinds of work that I love to do. So thank you very much again on behalf of patients everywhere. In addition to everything that you're doing, you Renaissance woman, I understand you've received 2 patents in biomedical engineering. Tell me about those projects.
Absolutely. So these patents were actually early on when I started medical school. I became aware of some of the common issues facing healthcare. And one that kind of stood out to me when I started rounding was hand hygiene compliance and how often healthcare personnel were actually washing their hands in between patients. And around the time that I started noticing this locally and places I had been rotating, the CDC had released a huge statement about it, saying that it was a systemic issue. And there were studies suggesting that some places have hand hygiene compliance as low as 39%. And that kind of stood out to me. And I said, there must be some way to address this. They had lecture series, they had posters on the wall that if you've been a patient, you've probably encountered, but those apparently did not work as well as we thought they might. And so that's what kind of led me to think about, well, can we come up with some way to monitor individual levels of compliance and have that used as an educational tool? And also, is there a real-time method that we can use to provide immediate feedback? So if somebody forgets or they're in the midst of something, it's like a reminder for them.
That makes complete sense, especially, I think this has really become to the forefront of front burner conversation in light of the pandemic that we are all still in the midst of. They called it social distancing, but it was physical distancing more than social distancing because we were still all social. But the hand hygiene component was absolutely imperative to stop the spread of those kinds of infections and diseases for all practical purposes. I started washing my hands and singing a song so that I remember to wash them for as long as possible. And you don't think about the fact that not just those of us just in society need to remember proper hand hygiene, but especially those who are healthcare professionals. And so I think that's really fascinating work. I was teasing you just a minute ago when I called you the Renaissance woman, but I'm about to get serious with you for 1 minute because we all need balance, Dr. Barsky. Thank you. What do you enjoy doing personally? And is there someone in your life you share that with? Now it's time for me to be the talk show host and ask those kinds of questions.
Totally. So I will say that I genuinely enjoy projects. So I love working on things, whether they be creating videos, painting. That's kind of how I've been spending my spare time. But I also love watching thrillers, true crime, and analyzing them. And so I'm consistently looking for someone to talk to about some of these more in-depth series. And that's kind of posed a challenge, interestingly enough.
But they're out there, I can guarantee you, because my favorite thing to do with my husband, who's also a lawyer and who also happens to be a judge. I just play one on television. He is an actual administrative law judge. But we are forensic files fanatics. And we love analyzing all of those kinds of shows. So they're out there. Those people are out there. You just need to make sure you are, quote, trolling in the right place.
It's tricky. And I had a recent longer term relationship that ended. And so I just started looking. But I think for me, what I'm really looking for is someone who's passionate about what they're doing and also passionate about me. So it's again, a balance, but also I really love people that enjoy what they're doing and can share with me and who I can learn from.
Okay. All right. I'll keep my eye open just in case. Literally, though, at the end of the day, as we come to a conclusion, what is the one thing you'd like the viewer of this video feature to walk away with?
So as a physician and an advocate, I would be remiss if I didn't mention something related to asking questions, staying on top of your health and staying informed about your health. And I think it's very important because sometimes we anchor on certain diagnoses and we struggle with something for a very long time and we're used to it. And in some cases, that requires reassessment. And that could be beneficial. We could pick up on something that's previously been missed or maybe something that's more easily reversible in a shorter period. So I really encourage my patients and I encourage people whenever I can to ask questions and never be afraid to seek a second opinion. as it's not something that will offend us. We're a community. We work together, and there's no one person who knows everything. And so I think that it's really important to keep that in mind. So that's what I would want to bestow on listeners.
I think that's a really great piece of advice. I always feel like being forewarned is forearmed. And if you can walk into a clinician's office with questions in mind, you won't be as intimidated from a patient's perspective to just say, doctor, these things have been on my mind and I really wanted to write them down so that I didn't forget anything. And I think that helps patients really be their own healthcare advocate. And so, Lili, Dr. Barsky, I have had a great time getting to know you and just the passions that make up you. And I think that you are somebody who not just has balance, you have integration. Work-life integration is what we're all striving for. And I think you may just have found it.
Thank you so much, Star. It's been wonderful speaking with you as well. And what a wonderful opportunity.